Today there are over 9,000 positive coronavirus patients in hospitals across England, and we know that number is only going to increase. That's why what you see here is a mass mobilisation taking place right across the country, but also at these new Nightingale hospitals. This has been an extraordinary team effort on the part of nurses and doctors and therapists and pharmacists across London, but also volunteers and paramedics and people returning to help. And when these services are needed, they will be available beginning later this week. And because this is a global health emergency, we're actually seeing similar types of hospitals being established in Berlin and Madrid and New York.
Will you be stretching your staff too much by moving people here and leaving other hospitals short-staffed?
The whole of the NHS is freeing up hospital beds for coronavirus patients. We've got 9,000 people across the country who are in a hospital right now, and we know that number is bound to increase. That's why we're also creating this extra capacity to look after patients, staffed by health service professionals, but also by those who are returning to help. 20,000 nurses and doctors have come back to help, as well as paramedics and volunteers from all walks of life.
Can you give any indication of how much staff sickness is affecting the NHS and people needing to self-isolate?
NHS staff are affected just like people across the country as a whole, and so we are seeing staff who are doing the right thing and having to self-isolate at home. That's one of the reasons why it's so important that we are ramping up staff testing, but it's also why it's so vital that all of us take the medical advice and stay at home. That will reduce the infections and reduce the need for services such as this new Nightingale hospital.
How quickly can you ramp up staff testing? Because you've started with about 800, doesn't seem a huge amount. How quickly can you get it to scale?
By the end of this week, we will be able to do double the number of tests that were available last week, and we want to start with critical care nurses, with A&E staff, with ambulance personnel, and then expand that to a much wider group of NHS staff over the coming days and weeks.
The government said another 8,000 ventilators were on the way to add to the stock of 8,000. How quickly will they arrive, and will they be enough?
We're expanding the capacity to look after patients who need ventilation very rapidly. We're able to effectively double that through using operating theatres and recovery areas in our existing NHS hospitals. And then over and above that, you see new facilities coming online like the NHS Nightingale Hospital here in London, but also in Manchester and Birmingham if needed.
How stretched are hospitals, particularly in London right now, in intensive care?
We've got, across the country as a whole, over 9,000 confirmed coronavirus patients in hospital beds today, and that number is bound to increase. As it happens, we have got available intensive care and available hospital beds, but we are also bringing online additional capacity, such as these Nightingale hospitals, as we need them.
What reassurance can you give NHS staff about protective equipment, some of whom feel it just isn't there?
It is vital that frontline NHS staff get the protective equipment they need. 170 million items of that protective equipment have been shipped. It's a huge logistics exercise. The Army have been brilliant in helping, but we know we're going to need more, and the government are pulling out all the stops to procure for us that personal protective equipment that we will want over the coming days and weeks.